What's in an Inkblot? Some say not much by Erica Goode. Psychology has produced few more popular icons than the Rorschach Inkblot test. Devised 80 years ago by a young Swiss psychiatrist, the Rorschach has entered the language as a synonym for anything ambiguous enough to invite multiple interpretations. And beyond its pop culture status, it has retained a central role in the personality assessment administered several 100,000 times a year by conservative estimates to both children and adults. In custody disputes, for example, the test is used to help determine the emotional fitness of warring parents. Judges and parole boards rely on it for insight into a prisoner's criminal tendencies or potential for violence. Clinicians use it in investigating accusations of sexual abuse, and psychotherapists as a guide in diagnosing and treating patients. Yet, almost since its creation, the Inkblot test has been controversial, with early critics calling it cultish and later ones deeming it as scientifically useless. And in recent years, academic psychology departments have been divided over the merits of the test, and some have stopped teaching it. The debate is likely to become even more heated with the publication of an article provoking discussion and anger among clinicians who routinely use the Rorschach. In the article, three psychologists concluded that the Inkblot test and two others commonly used, the thematic apperception test or TAT, and the draw a person test, are seriously flawed and should not be used in court or the counseling room. There has been a substantial gap between the clinical use of these tests and what the research suggests about their validity, said Dr. Scott O. Lilienfeld, an associate professor of psychology at Emory University and the lead author of the article. The research continues to suggest that they are not as useful as most purposes. The research continues to suggest that they are not as useful for most purposes as many clinicians believe. The review by Dr. Lilienfeld and two colleagues, Dr. James M. Wood of the University of Texas at El Paso and Dr. Howard Garb of the University of Pittsburgh, appeared in the current issue of the Journal of Psychological Science in the public interest as a publication of the American Psychological Society. Whew. The three tests are known as projective because they present people with an ambiguous image or situation and ask them to interpret or make sense of it. The test takers' responses are assumed to reflect underlying personality traits and unconscious conflicts, motives, and fantasies. In the TAT test, takers are shown a series of evocative pictures depicting domestic scenes and are asked to tell a story about each one. The figure drawing test requires drawing a person or on a blank sheet of paper and then drawing a second person of the opposite sex. While the Rorschach and other projective techniques may be valuable in certain specific situations, the reviewers argue the test's ability to diagnose mental illness, assess personality characteristics, predict behavior, and uncover sexual abuse or other trauma is very limited. The tests, which often take hours to score and interpret, add little information beyond what can be gleaned from far less time-consuming assessments, the psychologists say. They recommended that practitioners refrain from administering the tests for purposes other than research, or at least limit their interpretations to the very small number of indexes derived from the techniques that are empirically supported. Dr. Lilienfeld said that the review was written to raise awareness of the problems with the tests in the legal field and with the hope that maybe we can reach a small number of open-minded people, and in particular students who have yet to make up their minds on the issue. But, he added, I am confident that many will take issue with our conclusions. One of Those is Dr. Irving B. Weiner, a clinical professor of psychology and behavioral medicine at the University of South Florida and the president of the International Rorschach Society, who said the authors of the journal report took research findings out of context to bolster their case. Dr. Lilienfeld and his colleagues do not really understand how clinicians use the tests, Dr. Weiner said. They have been used for a long time very effectively with very good results and a great deal of scientific support, he said. Dr. Gregory J. Mayer, an associate professor of psychology at the University of Alaska at Anchorage, who has studied the Rorschach, said admonishing psychologists against using the test was not in the spirit or of advancing our science. He said the journal's decision to run the psychologist article was like asking someone who believes in creationism to review evolutionary theory and make recommendations about it.